Here is a comprehensive and structured overview of surgical clamps. 1. Introduction. Surgical clamps are essential tools in all types of surgical procedures. These instruments are used to compress or hold tissues, blood vessels, or surgical drapes. Their primary role is to assist surgeons in controlling bleeding, maintaining a clear operative field, and managing tissue during dissection and suturing. Definition. A surgical clamp is a handheld medical instrument designed to temporarily compress blood vessels, organs, or tissues during surgery to prevent bleeding or to hold structures in place. 3 types. Surgical clamps come in various forms, each designed for specific functions. Hemostatic clamps. Examples: mosquito clamp, Kelly clamp, cryo clamp. Use to control bleeding by clamping blood vessels. Use to secure surgical drapes to the patient. Intestinal and bowel clamps. Examples: Doyen clamp, used to occlude the bowel during resections. Vascular clamps. Examples: Satinsky clamp, used to temporarily occlude large vessels. Bulldog clamps, use small vascular clamps for temporary occlusion. Occlusion clamps, to temporarily stop the flow of fluids or blood. Atraumatic clamps, used to hold delicate tissues without causing damage. Parts. Typical components of a surgical clamp include jaws, the working ends that grasp or clamp tissue; serrations, grooves on the jaws for better grip; hinges, allow the opening and closing of the jaws; ratchets, lock the clamp in a closed position; shanks, the long shaft providing leverage; loops at the end for finger placement and control. Canada 5 uses control of hemorrhage, bleeding, holding and manipulating tissues, grasping surgical drapes, occluding vessels or ducts during surgery, assisting in suturing or dissection, temporarily holding surgical instruments. 6. Precautions. Ensure clamps are properly sterilized before use. Use appropriate clamp type and size for the procedure. Avoid excessive pressure to prevent tissue damage. Do not use damaged or rusty instruments. Always check locking mechanism before use. Avoid prolonged clamping to prevent ischemia. Advantages: enables bloodless field during surgery, reduces surgical time, improves surgical precision and access, facilitates handling of tissues, multiple designs available for specific tasks. 8. Risks and complications: tissue trauma or necrosis due to overclamping, slippage causing bleeding or contamination, clamp failure or breakage during use, infection if not properly sterilized, accidental injury to nearby structures. How to use step-by-step procedures. 1. Select the appropriate clamp. Choose based on the tissue or structure involved. 2. Check sterility and function. Ensure the clamp is sterile, clean, and functional. 3. Position the clamp. Gently place the jaws around the target tissue or vessel. 4. Close the clamp. Press the finger rings together until the ratchet engages and locks. 5. Secure the clamp. Confirm that the clamp is holding firmly without slipping. 6. Monitor the clamped area. Watch for signs of ischemia or slipping. 7. Release the clamp. Press the ratchet to disengage and remove the clamp gently. 8. Inspect the tissue. Assess the clamped area for any damage or bleeding. 10. Conclusion. Surgical clamps are indispensable tools that provide control, precision, and safety in the operating room. Proper selection, handling, and care of these instruments are critical to avoid complications and ensure successful surgical outcomes. Training and experience significantly enhance the effective and safe use of surgical clamps in all clinical settings. Thank you. Have a nice day.